Hi, my name is Brianna, and today we are going to be going over CBG, which is capillary blood glucose testing. This is something that you would be doing if maybe your client has diabetes or we're monitoring for high or low blood sugar. We're going to go over the ins and outs of all of the goodies and a setup and taking and take down. So in here we have the lance or your poking device, your glucose monitor, a container that will have your test strips, your lancets or your needles, and then back here we normally got band-aids and alcohol wipes, sharps container, super important, gloves, hand sanitizer, surface to work on that you can throw away. Always make sure to sanitize or wash your hands before getting started and wear gloves. We're dealing with bodily fluids. If you're using hand sanitizer, make sure your hands dry a little bit because the gloves will stick. You also want to make sure you have your sharps container nearby. You've got a paper towel, maybe some band-aids for your client, all your little CBG goodies, which are normally going to be in a nice little booklet, and you got your trash can nearby as well. Before I put both gloves on, also a good tip is to make sure your client's hands are nice and warm. If they're cold, being cold means poor blood flow. Poor circulation means no blood. But your hands are nice and warm, so we're good there. Awesome. So I'm going to go ahead and get one of my handy dandy alcohol wipes. I like to work on a paper towel. I can throw all my trash in there. Do you have a preference? Okay. Typically, ring finger and pinky tend to hurt less. So we'll go ring finger. I clean off the whole fingertip, even though technically I'm not poking the whole thing. Let it dry. You don't want to risk getting any alcohol right into that fresh wound because that's not going to feel good. I am going to get my lance and my lancet, poking device, and needle. And I'm going to go ahead and carefully stick that guy in there. Once I get that needle in there, this sometimes pushes it down all the way, so I will click it, which is going to pop it up to its highest setting. I'm not going to accidentally hit it, and it's going to poke forward and hit me instead. Give that circle cap a twist, gently pull. Carefully recap your lance. There's going to be a different number setting going along top. If your client has pretty thin skin, you're going to be poking like a 1-2. If your client has super thick callus-season, you're going to be poking like a 4-5. Ask your client what their preference is. If you're not sure, you can go with a nice soft middle. Pull back. You're going to see this changes color. Once you shoot it, locked and loaded. All right. You want to aim for the edging of your client's finger and not dead smack in the middle. Do you want me to count you down or just poke?
No, you're good.
Okay. Ready, set, boop. And I am going to just dab that little bit off. Make sure there's no rubbing alcohol that could have gotten into there. Get my test strip and add it on in. Once it clears out, it's ready, and you're just going to touch it to the finger, and you'll see it actually slurp up into the test strip. It's going to count you down and give you your reading. Beautiful. I'll take that rubbing alcohol wipe, clean off the client's finger. You can offer them a Band-Aid at this time as well, or sometimes I'll even just rip off a little piece of this and they can hold pressure for a second. With gloves still on, you are going to open up your sharps container, carefully take your cap off. Most will have a little lever on the opposite side. You push it straight down, needle pops out, so you never have to even touch that dirty needle. Never leave a used needle in here. I'm going to take all of my trash, ball it all up into my glove. All this stuff came in contact with blood, so that is not good. I'm going to go ahead and take that glove off over that trash and take that glove off over that trash. Now that bodily fluid has been double bagged and I can safely throw it away. Sanitize again. And we can put all this back away for our client. Get rid of our trash. And we're done.